action. With the people, the patients, families, and communities around the world, we are now embarking on a journey to eliminate avoidable harm in healthcare. It is indeed a landmark and historic moment for all of us. My name is Neelam Dhingra, and I'm the Unit Head of Patient Safety Flagship at the WHO headquarters in Geneva. And I have the great honor to open this event. It is also a privilege to co-moderate this event with Sir Donaldson, WHO Patient Safety Envoy. This is a launch event for the Global Patient Safety Action Plan 2021 to 2030. During the next 2 hours, we will formally launch the action plan, have speakers reflecting on the role of different stakeholders in reducing patient harm in healthcare and in implementing the Global Patient Safety Action Plan 2021 to 2030. I would also like to share some housekeeping instructions with you. This session is interpreted in French and Spanish. If you want to change the language, please click the globe sign at the bottom of the page. We have a dedicated time at the end of the session for question and answer sessions as well. And we would encourage you to post your questions in the Q&A box, which has 2 speech bubbles. If you have general questions, especially related to IT and logistics, questions that are not related to the content of the presentations, please use the chat box. Please note, this session is recorded and it's possible to get a certificate of attendance if you click the link in the chat box. Finally, I would like to also show you the data use slide as well. And now moving ahead with the agenda of this event, I have the great pleasure to invite Right Honorable Mr. Jeremy Hunt for his remarks on the global patient safety movement. Mr. Hunt is a member of UK Parliament and a global patient safety advocate. Mr. Hunt currently chairs Health and Social Care Committee in the United Kingdom. Jeremy, the floor is yours.
Thank you very much, Neelam. Hello to everyone. Welcome to you from all over the world. We are in the middle of a horrible pandemic, which has seen more than 4 million deaths globally, the biggest number of deaths from a pandemic in more than a century. And what has shocked people around the world is how many of those deaths could have been prevented. We know that if there'd been better infection prevention and control, we would have saved many lives. In the UK, where I'm based, many hospitals saw around 1/5 of their cases were people who actually picked up the infection inside hospitals. We know that if countries had been faster in following the WHO advice to test, many lives would have been saved. And we know that we can still save many lives if we speed up the rollout of vaccines to the developing world. But all of us in this conference know that avoidable harm and death in healthcare is a fact of life, even when there isn't a pandemic. And our job, what we are assembling to discuss, is how we can stop healthcare going back to the old normal, where 10% of all patients in healthcare systems in developed countries, developing countries alike, are harmed. Around 4% of hospital deaths are subsequently classified to have been avoidable. And patient harm is globally a top 10 killer. According to the WHO, it has a global burden of disease almost as high as AIDS and road traffic accidents, and higher than TB and malaria. So our mission is how we stop going back to normal. You share that, but we are incredibly lucky to have the support of the WHO. You'll be hearing from Dr. Tedros, without whom there would be no World Patient Safety Day, without whom there would be no Global Patient Safety Action Plan. There has been no Director General who has shown more commitment to the patient safety agenda than Dr. Tedros. I salute that. He's also a good friend of mine personally, and I know from when I was UK Health Secretary how he drove this change in the agenda through, and he's stuck with it despite all the pressures of a global pandemic. I also want to thank Dr. Liam Donaldson, who was talking about this and thinking about this for many years in the UK and internationally before I became aware of it. And also you, Neelam, for your single-handed commitment with the support, of course, of Dr. Susanna Jacobs, you've done a terrific job. So this plan is about making sure that it's not just words, conferences, it's actions. And this year we have a particularly important theme with maternal and child safety, because we know every single day 800 mothers die in childbirth and 7,000 newborns die. So what more important area could we make a difference? I'm just going to leave you with a rather nice Spanish saying, traveler, there are no roads, roads are made by walking. So let's all walk the road to a world in which patient safety is observed better and avoidable deaths are prevented. Thank you very much.
Thank you very much, Jeremy, and thank you for championing the cause of patient safety, not only in the UK, but across the world. Really appreciate you joining us today, and I hope you can stay for the rest of the time with us as well. Dr. Tedros, the Director General of WHO, will also be joining us later today. He is currently occupied in another high-level meeting. So we would now move on the next on the agenda, and it is my privilege to ask Sir Liam Donaldson, who is my co-moderator as well, to take the floor to give us the keynote address. Sir Liam is the WHO Patient Safety Envoy. The floor is yours, Sir Liam.
Thank you very much, Neelam, and thank you very much to Jeremy Hunt for the leadership that he's shown in getting us to this momentous moment where we have a plan globally for improving safety of care and reducing harm across the world over the next 10 years. So what I'd like to do in the 20 minutes or so that's been allocated to me is talk a little bit about the global journey on patient safety and what we can learn from the period that preceded this. And my personal journey on patient safety began when I was a young medical officer in one of the health authorities in the north of England, the Northern Regional Health Authority, in the late 1980s. And one morning I got a very distressed call from the manager of one of the hospitals in my region, saying that a patient had died, a man who was having a routine bladder exploratory procedure under anesthetic, but he'd died on the operating table. And essentially what had happened was that a fluid used to irrigate the bladder in such circumstances, and the wrong fluid had been used, and basically the result was the man died from shock and poisoning from the wrong fluid being used to wash out his bladder. And so I obviously noted this, but I asked the manager, you know, have you ever seen things like this before? And he said, well, myself and my colleagues around the region, we have a lot of these, as he called them at the time, accidental deaths. And we really don't know what to do about it. So at that time, it was 1989, I set up a reporting system in my region, but a young medical officer in one part of a country doesn't have very much influence. But when I became chief medical officer for the whole country, I set about trying to get this on the agenda of the National Health Service, and through a report called Organisation with a Memory, we set up the first National Health Service patient safety programme. And because I was also, by virtue of my office as chief medical officer in the UK, I was the representative on the World Health Organization Executive Board. So in 2004, we put a proposal and a resolution through the World Health Assembly, and formed an organization called the World Alliance for Patient Safety, which was a partnership between a large group of stakeholders, individuals, and the WHO. And the UK put in a substantial amount of funding to get that off the ground. So in addition to my day job as Chief Medical Officer, which was a busy one in the UK, I was also the inaugural chair of the World Alliance for Patient Safety. And it's interesting just, I think, to observe that the term patient safety wasn't widely used at that time. Most of the work on harm in healthcare, inadvertent harm, had been done in the United States, and the term there being used was medical error. And in some ways, as we've learned more about the importance of system in healthcare, the term error is a slight misnomer unless you understand the full implications of that term. So over time, we decided ourselves, we couldn't call ourselves the World Alliance for Medical Error, so we called ourselves the World Alliance for Patient Safety, because by that time, I'd also connected with some of the experts outside the health field, people like James Reason, the originator of the Swiss cheese metaphor for accidents. And those people had not particularly been involved in health before. So it was very enlightening to get their wider perspective on how accidents happen in other fields and how they can be prevented. And we also had representatives from the airline industry joining some of our meetings at that time. And at the same time, some of the big leaders in medical error, as it then was, people like Lucian Leap and Don Berwick, and then ultimately Atul Gawande, who helped with the surgical checklist. So we were assembling a program of work, but also a community of experts and leaders. And the World Alliance's first program of work included the concept of a global patient safety challenge. And we focused on something that we felt would unite the world's health systems, healthcare infection. And a particular strand of that, the idea of hand hygiene and its prominent role in both causing avoidable harm from infection in hospitals, but also its role in prevention. At that time, the alcohol rub or alcohol gel had been invented, but it was hardly used in any health facilities around the world. So that first challenge, Clean Care is Safer Care, was one thing. We set up a program to be led by patients and families who'd suffered harm, the Patients for Patient Safety program. Lucian Leap produced a set of incident reporting guidelines, and we had a research initiative and various other special projects in different fields of safety. So learning from that, and how this is going to benefit, I think, the implementation of this Global Patient Safety Action Plan, it's clear that you have to continue to maintain a wide group of experts and enthusiasts and people who are passionate about patient safety. If you do that, and Jeremy Hunt and others and Dr. Tedros have helped to expand that community, that needs to be there, and it needs to be constantly visible and constantly in action. We also drew in many of the leading agencies in quality and safety in the world. AHRQ, the Agency for Health Care Research and Quality in the United States, the Joint Committee for Quality and Accreditation in the United States. And because fortuitously, while I was in that phase of establishing the World Alliance, the United Kingdom presidency of the European Union came up in 2005, and I proposed that patient safety should be the theme of that presidency. So as a result of that, that was taken forward by other European countries, and they set up a program of work on patient safety as well. So looking back on that period, a few points to make before coming on to the new plan. The first challenge was well worth starting with because it generated a phenomenal level of engagement. We had at the beginning, led by Professor Peter and Benedetta Allegranzi, we had all the world's experts in healthcare infection, almost without exception, coming together to produce a set of guidelines on hand hygiene. And also providing a great deal of professional support and really lighting a fire in this whole field, which until then had largely been a professional backwater. And we brought it to the attention of health ministers over time in various launches. 85 to 90% of the world's health ministers signed a pledge to give priority to infection prevention and control in their health systems. It's still a problem, as Jeremy Hunt has said, but I think it's increasingly recognized during this pandemic, but also in the work done in containing the Ebola outbreak, that this aspect of patient safety is a matter not just for health ministers, but for prime ministers and presidents as well, because the amplification effect on viruses and bacteria with pandemic potential is a huge issue, and the opportunity to give attention to that and put more resources in is incredibly important. So that first challenge and the concept of a challenge, I think, set a good benchmark, because it was very important in bringing people together, not just in relation to that one idea of tackling healthcare infection globally, but also because it drew attention to wider aspects of patient safety as well. It ignited a much wider interest and created a lot of excitement, sometimes at the level of the general public in some countries who campaigned for, I remember in Malawi, people marching through the street with banners to promote the idea of hand gels and hand hygiene. So the challenge, I think, sends the message, the experience from that is we need to still have those challenges, and we have a new one in medication safety because they have a wider engagement potential. They get people excited, not just about the specific area, but also about the whole field of patient safety, and they draw together communities of experts and leaders in that field. So that was, although a special area of patient safety, the concept of the challenge in raising awareness and advocacy more widely was very, very important. The early work also led to patient safety being prioritized within health systems around the world. And in addition, research capacity was built up and capability, and the role of victims of harm, I think, was greatly much greater awareness about that was created by the Patients for Patient Safety program and led initially by Sue Sheridan, who's on the call today. So the main lessons from that, I think, is how much you can do with a focused program. But the weaknesses of that first phase, I think, were twofold. First of all, we didn't engage as fully as we could the mainstream of health service leaders, practitioners, and help them to understand what we were trying to achieve and to play their part in it. Now, that's not to underestimate the great work that's gone on in some parts of the world by clinical leaders and by clinical practitioners. But I think a very important object lesson was when we took the work of Peter Pronovost, which, if you may remember, Peter brought together this concept of a bundle of care, a series of 5 interventions that would reduce catheter infection in intensive care units. And he brought that in across the state of Michigan in the US, and mortality dropped by 60%, and millions of dollars were saved in hospitalization costs. And so we picked that up and worked with Peter in trying to introduce that in more countries. But it didn't work everywhere. And to begin with, people weren't sure why it wasn't working because the information about the bundle of care was widely promoted, and there was a lot of education on it. But eventually it turned out that the reason it didn't happen was because no work was put in to engage the clinicians. And Peter, in his original work in Michigan, had done a lot of work on so-called organizational development, culture, and engaging clinicians. But in his report, his research report, there was much more emphasis on the scientific basis of the bundle of care. And I think people hadn't realized how important the people side of it is. And I think so what we learned from that whole phase was that there are technical aspects to patient safety, but there are people aspects, and it has to be a blend of the technical and people. Otherwise, change can't be made. So that engagement, that people side of it is the first thing that I think in the new program, we should be able to do much better from what we've learned. And then the second thing that I'm afraid we have to acknowledge is if you look at the work over the last 15 years, the number of places and problems where transformational improvement has been achieved is in the minority. So the impact of all the work is has been more limited than I think we would have hoped for. So moving into this new plan, the challenge, I think, is to, first of all, engage on an even bigger scale than before, but secondly, to make a real impact and a measurable impact. And I'm very hopeful, having worked with Neelam and our colleagues to produce this plan, that it provides the basis to do that. And the thing I really like about it is that it's flexible. The overall goals are simple, they're holistic, they cover everything we think that needs to be done for a successful reduction in patient harm worldwide. It's context adaptable, so the ideas and the concepts and the goals will work in high, middle, and low income countries. And it's vertical and horizontal. In other words, it can drill down on very specific areas, but also it can sweep across a whole country or globally. And just in the final words, I have to say, I just wanted to pick out three of the 7 objectives which are driving the action in this report, in this plan. The first is the goal to make zero avoidable harm a state of mind and a rule of engagement in planning and delivering healthcare everywhere. Now, we had a real battle with the concept of zero harm because the patient safety world is divided on it. Some think you should have to have it there because otherwise you've got nothing to strive for concrete enough to excite people and get them passionate. And others say, well, it's unrealistic and unbelievable to think you could ever get to zero harm. So we did have a battle. We even had to remove it from the title in the consultation. But I'm pleased to say that I think the objective actually captures the essence of it. The idea, we acknowledge that you may never get there completely with zero avoidable harm, but to make it a state of mind and a rule of engagement in planning and delivering healthcare everywhere, I think is the perfect way of dealing with it. And when I was helping to frame that objective, I happened to read in a book a quote by Dr. Johnson, who invented the first English dictionary in the 1700s. And he said once, "It's reasonable to have perfection in our eye, that we may always advance towards it, though we know it can never be reached." And I think it's that aspirational quality and that energy and passion, the idea of zero harm, can be captured in perhaps a more subtle way than actually believing that you're trying to knock it all on the head and get down to zero. So that's an example of something that will work anywhere. It will work with the World Health Assembly, looking at the next phase of patient safety. It would also work with a small team delivering maternity care in a low resource part of the world, that they're doing their best, they have the attitude, but their problems and they're trying to solve and the tools at their disposal are much, much different. The second objective of building a high reliability health system and health organizations that protect patients daily from harm, I think that idea of protecting patients is the other side of the coin of investigating and dealing with problems in patient safety. And I think absolutely this idea of resilience has come home to us with the pandemic, but it also has a more universal attraction in building health systems that are universal health coverage, which isn't just resistant to shocks from things like pandemics, but is also resistant to the day-to-day things that can go wrong in healthcare. And that also operates at the level globally, nationally, and at the level of a small clinical team, whatever the context. And then finally, and this is just the third example from the 7 objectives, we have the third objective is assuring the safety of every clinical process. Think about that. If right across the world, everybody was looking at the granular clinical process that they deliver every day to patients, day in, day out, and saying, how can we make that really safe? That would be the release of a huge amount of beneficial energy in healthcare systems around the world as we try to crack this problem of avoidable harm. So finally, if we want to learn from what was done in the past and what has been done in producing this Global Patient Safety Action Plan, I think probably it would boil down to doing better and building on the successes so far. So almost to say, we're looking to improve how we improve, or to learn better to learn. And if we could do those two things, I think we would be on our way. But it's a very inspiring moment. Thank you again to Jeremy Hunt and Dr. Tedros for their brilliant support in this. You've made a lot of enthusiasts for patient safety very happy by supporting this process. But more than that, you have you've initiated action that will protect the lives of patients around the world and to save patients losing family members unnecessarily to inadvertent harm in healthcare. They will never know about this meeting, but the beneficial action that will flow from it will be universal. Thank you.
Thank you, Sir Liam, for very insightful remarks from yourself and very inspiring as well. Moving on, it is our honor and privilege that Director General of the World Health Organization, Dr. Tedros, has joined us for this event. I invite Dr. Tedros to take the floor for his opening remarks and also to formally launch the Global Patient Safety Action Plan. Dr. Tedros, we are really privileged. The floor is yours. Thank you.
Sorry, can you hear me, Neelam?
Yes, we can hear you very well. Thank you.
Thank you, Neelam. Dear Jeremy, dear Sir Liam, dear Joe, distinguished guests, dear colleagues and friends. First of all, I would like to apologize for not joining you earlier than this. I was in a conference for Lebanon. Of course, the conference is still going on, but I sneaked out to join you. And good morning, good afternoon, and good evening to everyone joining us today, wherever you are in the world, and thank you for joining us today. For thousands of years, medicine has operated on a fundamental principle, primum non nocere, first, do no harm. That principle is as true today as at the time of Hippocrates. No one should be harmed while seeking care. And yet, an estimated 2.6 million people die every year in low and middle income countries alone due to unsafe care in hospitals. The human cost is bad enough. This does not only deprive families of someone they love, they deprive the economies of these countries of up to $1.6 trillion each year in lost productivity. The vast majority of this deaths and the costs are avoidable. I often say that if healthcare is not safe, it's not care. Unsafe care harms people, but it also harms health systems by eroding trust. When people are not sure whether it's safe to seek care, they will think twice before seeking care. The result is a greater burden of disease, greater loss of life, and greater costs to the health system. The past 18 months has been an unprecedented time for our health systems. Beyond the disease and deaths caused directly by COVID-19, the pandemic has severely disrupted many essential health services and influenced the safety of care. Isolation, the infodemic, self-medication, and altered health-seeking behavior will have far-reaching effects for patient safety in the coming years. The pandemic has also highlighted the physical and psychological safety issues of health workers with clear implications for the safety of the patients they care for. No country, hospital, or clinic can keep its patients safe unless it keeps its health workers safe. Patient safety has become more critical than ever. That's why in May this year, the World Health Assembly adopted the new WHO Global Action Safety Action Plan 2021-2023, 2021-2030, the result of years of work and consultations with experts, the public, patient groups, partners, and our member states. The action plan has been developed to support our vision of a world in which no one is harmed in healthcare and where every patient receives safe and respectful care every time, everywhere. The action plan provides a framework for countries to develop their own national action plans on patient safety. It builds on 7 guiding principles: treating patients and families as partners, achieving results through collaboration, data-driven learning, translating evidence into actions, adapting policy and actions to context, improvement through expertise and experience, promoting a safe culture. And I would like to thank and congratulate our team at WHO and everyone who has contributed to developing the Global Action Plan. But this is just the beginning of our work. A plan is not worth anything unless it's implemented. This will require closing several gaps. First, there is a knowledge gap in understanding the extent of the problem and its contributors. Second, there is a policy gap. Most health systems don't have policies for patient safety, or they're fragmented. Third, there is a design gap with the inadequate application of safety science in many policies, strategies, plans, and tools. Fourth, we need to close the delivery gap in putting policies into practice to make a significant reduction in harm. And finally, there is the communication gap, which can only be closed when best patient safety practices and innovations are collected and shared globally. WHO is supporting countries to close these gaps by providing guidance, tools, and customized technical support through our decade of patient safety initiative from 2021 to 2030. Finally, next month, we will celebrate World Patient Safety Day with the theme of safe maternal and newborn care. The aim will be not only to highlight patient safety issues in this area of work, but also to drive and demonstrate a significant reduction in avoidable harm to mothers and newborns. Thank you once again to everyone who contributed to the development of this action plan. I'm delighted to formally launch the Global Patient Safety Action Plan 2021-2030. And now let's get to work and implement it. I thank you.
Thank you, Dr. Tedros. We really appreciate that you took the time to join us today and for your commitment to ensure that no one is harmed in healthcare and for efforts to leave no one behind in this 10-year journey to eliminate avoidable harm in healthcare. Thank you very much indeed, and really appreciate you formally launching the Global Patient Safety Action Plan. This is a great moment for us. Thank you.
Thank you, Neelam. Thank you for your leadership. Much appreciated.
Thank you very much indeed. So moving on, I would like to now walk us through the journey from the inception to the implementation of the Global Patient Safety Action Plan. I have structured this presentation to go through some of the key moments in the history of patient safety, building on to what Dr. Tedros mentioned and Neelam Donaldson and Mr. Jeremy Hunt mentioned about the global patient safety movement, the past, present, and the future. And of course, the global ministerial summits on patient safety, which have provided the great impetus and emphasis on the need for patient safety. Then I will go through the WHO resolution, which was adopted in 2019. And then we'll touch upon the actual process of the Global Patient Safety Action Plan development, the developmental process, how we consulted all the partners and colleagues, as well as the adoption of the action plan. And then I will conclude by a few words about the decade of patient safety, which Dr. Tedros also mentioned. So the slide here shows the foundation of patient safety was actually laid when the first report to Are Is Human was launched in 1999. And that was the start of a new era for patient safety with the resolution at the World Health Assembly in 2002, as well as the first Global Patient Safety Challenge on Clean Care is Safe Care, the second Patient Safety Challenge launched in 2005 on Safe Surgery, Save Lives. Then there was a rejuvenation phase, which Mr. Jeremy Hunt earlier mentioned, from the starting of the first Global Ministerial Summit, which was actually organized under his leadership, hosted by the UK government in London. That was followed by the leadership of German government of the second Ministerial Summit in Bonn, and where the WHO third Global Patient Safety Challenge on medication without harm was also launched. The third Ministerial Summit took place under the support of the Japanese government, and the Tokyo Declaration on Patient Safety was launched at this summit. And then WHO also launched a highly interactive Global Patient Safety Network. But I must say 2019 was the watershed moment for patient safety. Patient safety was recognized as a global health priority by the World Health Assembly, and the resolution on global action on patient safety was adopted under the leadership of UK and Kenya and several countries, leading countries around the world. The World Patient Safety Day was established as a formal WHO mandated day for the 17th of September to be observed annually. And the fourth Ministerial Summit also took place under the leadership of the Kingdom of Saudi Arabia, and a Jeddah Declaration for Patient Safety was launched. And in addition to that, under the presidency of the Kingdom of Saudi Arabia of G20, patient safety was included as a standalone agenda item under this presidency. So this was a great year for several new developments for patient safety. And now we are moving ahead with creating a future vision through the Global Patient Safety Action Plan for next 10 years, the WHO flagship initiative, A Decade of Patient Safety, which is WHO's response to implement the action plan. And then the 5th Ministerial Summit, which was planned for 2020 and would possibly be held next year or the year after. But this annual Ministerial Summit series continues to seek political commitment for patient safety. And then also I'm happy to share that patient safety actually is also the legacy agenda under the Italian G20 presidency. And we have a major initiative on global patient safety collaborative together with the UK government to define and support the concrete mechanism for country support and cooperation. Next, please. So just to share with you some of the visuals of the ministerial summits which have taken place over the years, from 2016 in London, as well, and then in 2017 in Germany, and 2018 in Japan, and 2019 in Jeddah, in Saudi Arabia, and then the commitment from the Swiss government for 2020, which of course was put on hold due to COVID. And I really appreciate Dr. Tedros for his leadership and commitment and support through all these ministerial summit series. Next, please. I shared this with you already, that this was really a watershed moment when we actually adopted the resolution. Next, please. And the mandate for the Global Patient Safety Action Plan came from this 2019 resolution, the Global Action on Patient Safety, which asked WHO to formulate a Global Patient Safety Action Plan in consultation with member states and all relevant stakeholders, including the private sector, for submission to the World Health Assembly in 2021, which was this year. And this actually was also adopted by the Executive Board in January. Next, please. The purpose of the action plan globally is to provide strategic direction to all stakeholders through policy actions, provide a framework to develop national action plans on patient safety, also align existing strategic instruments for promoting patient safety in all clinical and health-related programs, and provide implementation guidance for the mandate provided by the resolution of 2019 on global action on patient safety. Next, please. This is just a roadmap or the journey in the developmental process, and I won't go into details, but you can see that it was really years of work which has really culminated to the success of today, that we have an action plan which actually gives us a foundation for concrete action and work for the next 10 years. So we started with scoping and literature review. Immediately after the resolution was adopted in May 2019, we had several WHO internal consultations through several levels of the organization, as well as to different departments at all 3 levels of organization. We had a major global expert consultation in February last year, where we had 44 countries represented and all international organizations with key interest and commitment to patient safety joined this consultation for creating a foundation for developmental process of this action plan. We went through a major drafting and consultative process through the public consultation, several rounds of member state consultation, submission to the Executive Board in January, and then finally it was adopted as a decision of the World Health Assembly this year in May. Next, please. It was already mentioned by Liam also that the action plan actually has a very, very important vision for us, something which we really want to achieve globally, that a world in which no one is harmed in healthcare and everyone receives safe care and respectful care. Working in facilities and services, all stakeholders and all levels of WHO, with a very clear mission to work towards implementation and drive forward policies and strategies through a vision and also this vision and also science and patient experience and system design. And with the goal to achieve the maximum possible reduction in avoidable harm due to unsafe care globally. 7 guiding principles were already highlighted by Dr. Tedros, and there are 7 strategic objectives which touch upon this and which create a framework for action. And under each of these 7 strategic objectives, there are 5 specific strategies for concrete action. And under these strategies, we have actions for the 4 partners in action. It's a very well structured framework which countries can adopt and adapt as suitable for their context. Next, please. And as I mentioned, that this is a 7x5 matrix with 7 strategic objectives and 5 strategies under each, which actually provide a very comprehensive approach to patient safety and also creates linkages with other elements of health system to create a sustainable foundation for patient safety across the world. Next, please. And I'll just go through these strategic objectives and what are the sort of the strategies covered under it very briefly. So the first one on policies to eliminate avoidable harm in healthcare and making zero avoidable harm to patients a state of mind. Next, please. This covers patient safety policies and strategies and implementation framework to be created at national level, mechanism for resource mobilization and allocation for patient safety, protective legislative measures to provide the safe environment for learning from errors and for reporting and learning purposes, safety standards, regulation and accreditation, and also World Patient Safety Day and Global Patient Safety Challenges as concrete initiatives to take forward in future. Next, please. The seventh strategic objective on high reliability systems is to build these systems and organizations that protect patients daily from harm. Next, please. And under this, we cover the importance of transparency and open and no blame culture, good governance for healthcare system at the organizational level, as well as leadership capacity for clinical and managerial functions, human factors and ergonomics for health system resilience, and also patient safety, particularly in current context of emergencies and outbreaks and settings of extreme adversities. Next, please. Safety of clinical processes is where actually the care is provided, the point of care to ensure all processes are safe and all the risk-prone processes and procedures identified and proactive steps are taken to prevent harm. Next, please. So in this, we, of course, cover safety of risk-prone clinical procedures, the patient safety challenge on medication without harm, infection prevention and control and antimicrobial resistance, safety of medical devices, medicines, blood and vaccines as products, and also patient safety in primary care and transitions of care. Next, please. The fourth strategic objective relates to patient and family engagement and having patients and families as co-producers of health and partners in health. Next, please. So co-development of policies and programs with patients, learning from their experience, also having promoting advocates and champions and their capacity building, patient safety incident disclosure to patients, as well as information education for patients and families. Next, please. Coming to the health worker education skills and safety, and this has really become very relevant in today's context, particularly addressing the health worker safety in the COVID time. So inspire, educate, and skill and protect health workers to contribute to the design and delivery of safe care systems worldwide. Next, please. And in this, we cover patient safety in professional education and training, centers of excellence for patient safety education training, competencies in patient safety as regulatory requirements, linking patient safety with appraisal system of health workers, and also safe working environment for health workers. Next, please. The next strategic objective is on information research and risk management to ensure a constant flow of information and knowledge to drive the mitigation of risk, reduction in the level of harm, and improvement in the safety of care. Next, please. And this particular strategic objective relates to incident reporting and learning systems, information systems, surveillance systems, and also research programs and digital technology for patient safety. Next, please. The strategic objective 7, which is on synergy, partnerships, and solidarity, to develop multi-sectoral and multinational synergy, partnership, and solidarity to improve patient safety and quality of care. Next, please. And this we touch upon stakeholders engagement in detail, common understanding and shared commitment, networks for patient safety and collaboration, cross-geographical and multi-sectoral initiatives in alignment with technical programs and initiatives. Next, please. So this was the overview of the strategic and framework for action, and I wanted to just touch upon these strategies which are embedded in these 7 strategic objectives. Then we have also covered a very important aspect of monitoring and reporting in the action plan, and there are 10 core indicators which are linked to the strategic objectives, and there are several advanced indicators which are for countries to assess whether they could also collect data on those indicators. But there are 10 core indicators which we aspire to collect for every 2 years, with the mandate to report to the World Health Assembly every 2 years. So this is an example of one of the indicators under strategic objective 1 is number of countries that have developed a national plan or equivalent for implementing patient safety policies and strategies. And then we've given also global targets which are over this 10 years period, so that more and more countries can then prioritize patient safety, and then a proportion of countries that have developed national patient safety action plan or equivalent would then be our target moving on. Next, please. Couple of steps which we have provided as possible milestones which countries could work for while they're implementing patient safety ecosystem, and which has, of course, upstream factors working with governments, downstream factors at the point of care, and several coordination mechanisms, which are the lateral sort of stream factors which influence the implementation, and going through the landscape assessment of safety risks and barriers to improvement, commitment from political and organizational leadership, sustainable mechanisms, national context and priorities, and of course, what models of change they would like to utilize to bring about the change. Next, please. So with that, I would like to thank you for your attention, and I hope that this presentation has provided you a good overview of the journey from the inception to the implementation, and we look forward to your support and collaboration in taking action to implement this Global Patient Safety Action Plan. Thank you very much indeed. So now we are ready to actually move ahead with the next agenda, and I have on the list Dr. Evelyn Wesangula from the Ministry of Health of Kenya. Evelyn will speak about actions from governments using the newly launched Global Patient Safety Action Plan as a tool to trigger actions at policy and governance level. Dr. Evelyn, the floor is yours.
Thank you very much, Neelam, for the great introduction, and great congratulations to WHO for leading this process. And of course, what comes to our mind after our global document is launched is implementation, which is actually the next step. And we are hoping that governments will be able to take up the global action plan and make it practical at the local level, because that's when success will be realized. Just like the DG said, what matters is the actions that take place after a document has been launched at a global level. So it's my pleasure just to take us through what does it look like after the global launch of this global action plan on patient safety. What happens when it gets to the hands of government at the end of the day, because the implementation really must happen at the local context. There are some considerations that we need to take in place. For example, government ownership. Why is this so important? It's good for us to realize that whenever you have a global action plan that trickles down to country level, the realization that the government is pursuing multiple objectives at any given time is real. I know for the patient safety agenda, action must be taken now, but we are also cognizant of the multiple objectives that government is handling at specific moments. The second issue that we begin to think about is that the policy choices that any government is going to make will really reflect on the concerns of the diverse players in and out of government. So what's the level of sensitization with regards to patient safety matters has been done or is going to be done at the government level, those that are within government and those that are outside government, the people who are going to make decisions regarding how the patient safety agenda is taken on at a local level. The third consideration, you have different players, even within the government. You have parliament or the parliamentarians that make laws. You have regional and local authorities that are very critical in the reform process. And when we go through the global action plan, you realize that you're actually going through a period of reformation. And this is so key in patient safety initiatives. So we need to realize that the parliament needs to be sensitized. They need to be aware. They need to be part of this. They need to buy into the whole patient safety action plan for us to have meaningful a commitment and engagement at a country level. Then the fourth aspect is the aspect of striking a balance between competing influences. What is going to be so compelling about our global action plan on patient safety that's going to cause a shift in the way the government is going to react in terms of taking it in and making sure that the recommendations of the global action plan are actually taken up at country level and implemented to the lowest level possible, because we realize we're not just focusing on healthcare settings in terms of reforms, we are also looking at the community level. You're looking at reforms in the way that the patients and the public engages when it comes to the provision of healthcare services. And then finally, we are considering the strategic interactions that must take place between the government and the various collective stakeholders for these reforms to happen in an effective manner. Next slide, please. So some of the key questions that we begin to ask ourselves when we take down the global action plan for implementation at the local level. What are the problems that we want to solve at a country level, for example? What do we want to achieve? And what will happen if we don't change? We need to consider what needs to be done. We also want to consider what kind of interventions should be packaged together. We also want to go through addressing and analyzing the management support systems that will be best organized to service the kind of interventions that are being proposed under the Global Action Plan. And finally, how can we tell if we are making impact? I think these are critical questions that need to be addressed. Like in the previous slide, we said, we need government to engage with the stakeholders within the government and outside the government. Go through some of these key questions that need to be addressed at a country level for everyone to come to a common understanding why the Global Action Plan must be tailored to the local level to address the patient safety challenges that we have all realized exist in our healthcare systems. When these key questions are addressed at a country level, then it becomes easier for the Global Action Plan actually to be tailored to the national level. Next slide, please. So after those questions have been asked and answered and key considerations made with respect to the competing priorities that governments actually have at all times, there are some actions that the government can actually be able to take. Number one, to recognize patient safety as a health priority. And this will only happen if there is an adequate level of awareness creation that is done at the highest level of government, and also at the lowest level, that's the community. Because when there's demand for safety in the process of providing care, the need becomes a health priority even for government. Once that has been realized, then there's a need to establish national patient safety programs. The place of coordination, because patient safety is not a siloed program. It cuts across all services that are delivered through the healthcare system. So what that presents is multiple stakeholders. And in the absence of proper coordination and collaborative structures, then it becomes a problem to be able to deliver a national action plan effectively. So that brings us to the third level, which is collaboration with other stakeholders that must be deliberately and consistently done to ensure that you're able to harness the necessary resources to implement the patient safety action plan, and also to make sure that all stakeholders understand their different roles that they need to play to deliver the action plan at a national level. That will result in the mobilization of resources. And then we talked about the place of parliamentarians. We will need legislation to facilitate safe patient care and also healthcare worker protection. What's the legal provision that government can actually make to ensure that this is not just a document that is only encouraging compliance to standards, but actually making sure that compliance is part of the delivery of healthcare services. And that will work alongside aligning regulatory processes, inspectorial mandates, and accreditation activities, just to ensure that the safety components are well taken into consideration. The other aspect that the governments also can take is to make sure that they have been able to engage and empower patients and families from the beginning. Most of the time, the patients and providers are left out of critical decision-making processes, but the government has an opportunity of creating enabling policies that will enable the patients and their families and the caregivers to contribute to the policy formulation process. And when that happens, and you have both a top-down approach and a bottom-up approach where you have all the stakeholders involved, owning actions, and at the end of the day, there's effective delivery of the interventions that have been proposed. Then as you look at some of the other actions that the government can take is to ensure that there's an assurance of the safety of every clinical process. And this is what patients want to hear, that the government has actually assured them that every clinical process has been carefully thought through and that safety measures have actually been woven into each of those clinical processes. So through the development of guidelines and policies and standards, this is actually possible. And if it is led by the government, it's actually much better. And finally, the governments can also commit to build highly reliable healthcare systems. And this can also be made much better if they can build in a culture of safety to make sure that they are able to deliver safe services to all their clients. Next slide, please. And of course, I've already talked about the enabling structures, very critical to take this work forward. And we are not just focusing on patient safety, like Neelam said, but also looking at health workers safety programs with a dedicated focal point, with funding and broad representation with clear terms of reference to make sure that this work happens in the right way. Next slide, please. And of course, making sure that we have a knowledgeable and fully skilled health workforce to ensure that we are able to deliver healthcare in a safe manner, and also ensure that we generate data for action. A lot of our countries are probably not generating enough data for learning and action at the end of the day. So we are hoping that the government will ensure that there is constant flow of information and knowledge to drive safety, and ensure that the culture of safety is inculcated, and it is not punitive, but rather encouraging reporting so that action can be taken to ensure that safety is actually part of all the care processes in the healthcare system. I already talked about the networks and partnerships, which are critical because this is not just a government-driven process. Next slide. So in terms of awareness, this is critical. High-level advocacy can be taken up by government with targeted messages for different communities to ensure that there's also community participation to enhance collaboration across all stakeholders. And this can actually be augmented by the campaigns on patient safety that should be regularly conducted to ensure that the right messages get across both the policymakers and the community at the same time. And of course, we should be able to monitor and evaluate all the interventions that will be put in place. And last but not least, the place of impact stories. Governments can also embrace impact stories to create change within the healthcare system to ensure that safety is part of all the processes. Next slide. So this is how the Kenyan Ministry of Health is taking up the Global Action Plan on Patient Safety. We already have established a division of patient and health worker safety. We realized earlier on in 2014 that patient safety cannot be achieved without addressing health worker safety as well. So we have a dedicated division focusing on patient and health worker safety. And we started off with the infection prevention and control and antimicrobial resistance programs as our entry point into patient safety. And we have now broadened to address all patient and health worker safety related aspects. Next slide, please. And with that commitment from the leadership at the government level, we have been able to appoint a multidisciplinary advisory committee that include patients with clear terms of reference. And the picture here is just showing one of our advisory committee members who is actually a patient participating in our first meeting to develop the national policy for safety, for patient safety and healthcare worker safety. Next slide, please. So this is our draft national policy on patient and health worker safety and quality of care. These two are actually coming together because we all fall within the same division and addressing the same patient. And this work is actually being supported by WHO currently. We have our second draft of this policy, and we have a vision to have a safe, respectful, and responsive quality healthcare system for a healthy, productive, and globally competitive nation. So with the support of WHO, we are looking forward to launching our first ever policy on patient safety during the World Patient Safety Day, and we are excited about the work. We are excited about the guidance that the Global Action Plan has provided, because it has actually made it much easier for the country to visualize what the whole aspect of patient safety is supposed to be or supposed to look like. Because initially it was very complex when we try to envision the different components and the different pieces that must come together for you to have a policy that makes sense with actions and interventions that can be implemented at a national and a local level. Next slide, please. So as I conclude, looking at the Patient Safety Global Action Plan, what we can say is that governments can actually make a big difference. It is actually possible for every government to adapt the Patient Safety Global Action Plan as a blueprint. It actually provides the direction when you look at the different objective areas. And the second aspect about the Global Action Plan is that it presents it is actually a strategic and practical document, cutting across the diverse settings that countries are in. You have high-income countries and you have low and middle-income countries. So what the Global Action Plan provides for us is that it presents actions for every government to undertake. You can actually start in any place. We don't have to have everything put together. We don't have to have all the systems working. What the Global Action Plan presents actually is actions for each government to pick up and begin the journey towards patient safety. And we also recognize that countries are different. And what that means is that each country will definitely have a different approach, and every country needs to find the best fit for the patient safety programs within their setup and also within their resource capacities. And as I finish up my presentation, I just want to emphasize on the role of advocacy and awareness. We all appreciate that patient safety is a priority and should be a right for every patient, but not everyone knows this. So we must be deliberate in investing in advocacy activities. We must deliberately invest in creating awareness. This is so critical and needs to be done from the highest level of leadership to the community level. When this happens, then this patient safety agenda will rise to the top of the priorities that governments need to address. Without advocacy and awareness, we will keep competing with all these other priorities that governments have. But when we invest in advocacy and awareness like we are doing today, then this is going to generate the much needed attention and drive the patient safety agenda forward. Thank you very much for your time and for listening. And we are looking forward to implementing this to the lowest level possible. Thank you. Over to you, Neelam.
Thank you, Evelyn. This is wonderful call for action to governments and government institutions and entities across the world, and sharing your experience from Kenya, how you have taken the lead in implementing key elements of the action plan. While it is still today launched, but you have really taken it forward in a very significant way. And it's really inspiring, and you know, there's a lot to learn from what you presented, and I really appreciate Evelyn. Thank you very much indeed. Next, I have the pleasure to invite Professor Hian Tan, who is the Group Director and Senior Associate Dean, SignHealth, Duke NUS Institute for Patient Safety and Quality in Singapore. Professor Tan will share his insights on how facilities can create a system that maximizes patient safety and reduces risk of harm. Professor Tan, please take the floor.
Thank you, Dr. Neelam. I'm very happy to be here at this launch, and everyone who are patient safety champions or experts are all here, and I'm so happy. And I'd just like to congratulate Dr. Neelam, Dr. Tedros, and Sir Liam for coming out with this remarkable movement, because this will bring patient safety to the next level. Today is an important landmark occasion for patient safety, I believe. So for the healthcare facilities, they are wide-ranging. They range from primary care to tertiary care to secondary care, and also to long-term and community care with specialized services. So it's a very wide-ranging aspect relating to this. Next. Healthcare facilities are partners in this action plan. We will advocate and translate the strategic directions and recommendations from the Global Patient Safety Action Plan, which is a remarkable document that have very good salient points on how we can proceed forward towards eliminating avoidable harm in healthcare. Next. There are many good points within the document, but I just want to highlight a few salient points. The first one is that the mindset of making zero avoidable harm. In SignHealth, where I come from, we call it target zero harm. And this is the essence of healthcare. First, do no harm. As mentioned by Hippocrates a long time ago, and we should be doing this all the time. That's to achieve maximum possible reduction in avoidable harm due to unsafe healthcare globally. I know this has been mentioned by the previous speakers, but this point cannot be overemphasized, because if we lose sight of this point, we would not be able to proceed forward. We need to drive forward policies, strategies, and action that are based on science, patient experience, system design and integration, and work with all partners in the whole continuum of care to eliminate all sources of avoidable risk and harm to patients and also health workers. Next. The second point which I want to mention, which is very important as well, which was also mentioned, was the need to build high reliability health system and health organization that protects patients daily from harm. This is to ensure that our health system have consistently optimal outcome. And this will require robust process improvement, quality improvement, strengthening systems, and strong leadership commitment. There's also a need for healthcare facilities to build high reliability within their operating context and resource availability. Next. The third point I want to mention is about the need to develop a culture of safety in our healthcare facilities. This is important for any sustainability that we are doing towards patient safety improvement. The safety culture must be part of the organizational philosophy of the healthcare facilities. So this requires leadership commitment, transparency, open and respectful communication, learning from errors and best practices, and also a judicious balance between a no-blame policy and accountabilities for it to be successful. A strong safety culture is core to reduce patient harm and critical for providing a safe working environment for health workers. It's also important to create a psychologically safe work environment where healthcare workers can speak up without fear of consequences. Next. Also, it's important for frontline service providers to work collaboratively with all the partners, from policymakers to health workers in government organizations, various healthcare stakeholders, and also the WHO. There's also very important to engage patients and families as partners in safe care. In SignHealth, we have a maxim called patient at the heart of all we do. So that's exactly what we do, is to be able to bring patients to better care and to help them to recover. The COVID-19 global pandemic, which all of us are in now, have brought a lot of challenges, but also increased recognition of the risk to patient and staff in the healthcare facilities. There has been impetus to promote safer care at every level and to make the healthcare more resilient to the impact of harm than ever before. And this requires us to work better together. Next. So the final part is I want to mention is that there's a need within healthcare facilities to build capacity and capabilities to promote leadership, learning, and sharing. We want to enhance awareness and promote understanding of the Global Patient Safety Action Plan for leaders and healthcare workers up at every level, up even down to the point of care. We need to assess the current healthcare practices, identify areas for improvement, and priorities for actions among the various strategies within the action plan. We learn from each other, share, harness, and adapt best practices, and work towards developing an effective contextualized implementation for the care of the needed areas. Next. So in Singapore, we are very keen on the Global Patient Safety Action Plan. We're actually excited by it. And we have come up with a program called the Global Action for Leaders and Learning Organization on Patient Safety, in short called GALLOPS. So this is organized by my cluster, which is the Singapore Health Services. We call it SignHealth. And there will be speakers and participants from Singapore, Asian countries, and also the World Health Organization Patient Safety Flagship led by Dr. Neelam. The purpose is to learn and share best practices that can be contextualized and adapted for each of the countries. Next. So in these programs, we hope to bring 100 and more healthcare leaders, of which some of you are here, to accelerate actions to implement the global action on patient safety, establish a network of patient safety advocates to foster real-time engagement for learning and sharing of best practices, and also to help develop multidisciplinary teams across different areas of care to prioritize strategies, develop actions for healthcare facilities, and to improve patient safety. Next. This is the GALLOPS curriculum, and it's actually an outcome-based curriculum that's mapped to the intent, strategies, and actions of the Global Patient Safety Action Plan. There are two parts to this. First is the webinar part, which will be done this year. And the next year, we have an on-site session in Singapore where we bring everybody to discuss and share best practices. Next. So the Global Patient Safety Action Plan, you have seen this. It is very comprehensive, and I believe if it's implemented well, will make a difference to patient safety, bring patient safety to the next level, and reduce adverse harm globally. Next. And it offers us unique and exciting opportunities as healthcare workers and leaders working in healthcare facilities and services to build a better healthcare system together, aiming towards effectively eliminating avoidable harm in healthcare. And it's important to work within a collaborative global ecosystem. And this is essential. And all of us here with attending this launch are part of this global ecosystem. And it's important for us to push this forward to bring patient safety to the next level for the healthcare facilities. Thank you very much. Next. Thank you so much. Thanks.
Thank you so much, Professor Tan. The action for, the point of care action actually takes place at healthcare facilities and services. So what you have highlighted, that whether it is a primary care level or secondary or tertiary care, all settings, whether it's physical health or mental health, and whether it is clinical programs or health programs, at all health services and facility level, there's a need to embed patient safety in every action which is taken. So the safety of clinical processes, particularly which is taking place at the bedside of patients, is what you have touched upon. And particularly your emphasis on leadership, capacity building, and the Gallup program is absolutely amazing and exemplary. And I think that this program, I hope, could be globalized and we could actually build capacity of healthcare leaders and learning organizations in patient safety, utilizing the framework of the Global Patient Safety Action Plan. So really appreciate you taking time and sharing the Singapore Health and also the Institute for Patient Safety and Quality journey and how you're going to implement actions at the health facilities and services level. Thank you very much, Professor Tan, once again. Next on the agenda, we have Mr. Kiani, who's the founder of Patient Safety Movement Foundation, an organization which is leading the work on patient safety in several countries around the world, and particularly Joe's passion for patient safety and to achieve zero preventable patient harm is truly inspiring. Joe, please take the floor to reflect on strengthening collaborations and partnerships for the implementation of the action plan from your point of view. Over to you, Joe. Thank you.
Thank you so much, Dr. Neelam. I would like to really thank the incredible work that you have done under the leadership of Dr. Tedros, who's just an incredible humanitarian, and making patient safety a WHO prerogative. There's nothing that you guys can't not accomplish. You have done so much when you put your attention on it, and to have the WHO with us is incredible. I also want to thank people like Mr. Jeremy Hunt, who did so much work when he was Secretary of Health, began the ministerial patient safety summits, which I think did so much to move patient safety forward. His incredible work to create transparency at NHS, which is the first country I know of that the UK, which under Jeremy Hunt, did this to report every harm. Now, that's really important because we will not know how well we're doing if we don't have transparency and have every hospital report their harms. I want to thank many, many stakeholders who have come to make patient safety a priority, including President Biden and President Clinton. President Clinton has been with us from the very beginning and did so much to attract the attention of many, many people that normally don't pay attention to patient safety movement. Before I move on with my presentation, I want to let Dr. Hian know we created the curriculum with the help of many university stakeholders like Geisinger and Chapman and University and San Diego State University for patient safety. It's available on our Patient Safety Movement Foundation website. As you make your incredible work, it might be a good way to start. Okay, so let me get started with my presentation. And I'm really glad that right after me, Dr. Ratna Devi will be speaking. When we began, we understood this value of partnership. We understood that no one person is going to be able to solve this problem of patient safety by themselves. The problem in developed countries was that patient safety problems, medical errors that were not addressed with good processes were typically the third leading cause of death. And in developing countries, it was safer to stay home than to get care because of medical errors that were not dealt with good processes. And one person cannot solve the problem. It needs everyone to get involved. It needs everyone to take a leadership role, and it requires a partnership between hospitals, technology companies, government agencies, policymakers, clinicians, engineers, payers, and probably most importantly, patient advocates. Those people who either have survived a medical error or unfortunately were family members of those who died from medical errors. And I think they're most critical for two reasons. One, they don't accept the limitations that we have become accustomed to, and they become our champions, our cheerleaders to keep us moving. Number two, as an engineer, you've got to understand what the problems are, and you have to then see if there's a solution to those problems. So identifying the challenges that are killing people and creating solutions to mitigate them. These are what we call actionable patient safety solutions. And these are based on evidence that's in the clinical literature, some of them 15 years old, that we have put together in small checklist fashion forms so that they're easily implementable and followed. And we ask hospitals to implement them. And we ask healthcare technology companies to share their data so that hopefully one day, using technologies like artificial intelligence, we can take advantage of this patient data to help each individual by noticing problems before clinicians do, because that's what computers are good for. They keep track of everything. And with the right expert system tools, we can provide Six Sigma type of diagnostics that very few clinicians can have. Number five, promote transparency and aligned incentives. Nothing's more important than everyone knowing what's happening, reporting every medical error, reporting every harm, and having governments align the incentives of hospitals with patient safety. For example, by paying for all care when processes like the actionable patient safety solutions are implemented, even if someone gets harmed, and not paying for care when someone is harmed and those processes did not exist. Number six, promote patient dignity and love. Bringing love to the patient is the most important thing. Caring like you care for your own child, your own family member, is what good clinical care is. And giving dignity to the family and the patient so that they can speak freely about what they think is happening. They can be the best partners in their care. And last but not least, educate, hardwire patient safety. It shouldn't be something clinicians talk about 5-10 years after they've been in healthcare settings. It should be what they learn from year one. And we have, as I mentioned earlier, created a curriculum that allows that for nursing, for doctors, for pharmacists to make patient safety part of their curriculum. Next slide, please. These are the actionable patient safety solutions we help create. Number one, culture of safety, all the way to avoiding venous thromboembolism or avoiding medication errors, neonatal care to avoid blindness in the neonatal ICU. Next slide, please. You can find all these, by the way, on the patientsafetymovement.org website. And one of the things I learned from one of the hospitals that implemented these actionable patient safety solutions is you don't hope for zero, you plan for zero. And I remember after one of our meetings, this hospital decided to not only align the incentives by making part of the bonuses for the faculty, a third of it, based on zero preventable deaths. And once they did that, once they created that, the next thing that happened, they started making sure they get there. So what did they do? They went to the actionable patient safety solutions. They marked green for the steps they were doing and red for the parts they were not doing, with a mitigation plan into how to turn the red to green. Next slide, please. So take a look at this hospital. This is Children's Hospital of Orange County in my town, my hometown. And after implementing all of these actionable patient safety solutions, it's been now 53 months and they've not had one preventable death. You can see how they used to denote each child that was harmed, which I thought was really good, to show that every child mattered, every person mattered. And you can see on the left side, before they began this process, all of the red and unfortunately the purple, which means death. And then look on the right. And at the beginning, when they began, by the way, they had one death. You'll see it at the very beginning. And this hospital, instead of giving up on zero, they increased the bonuses associated with zero preventable death. And look what they've accomplished. So I know we can do this. I know if we put the processes in place, human error, which is common, especially the way clinicians have to work under stress, under many hours, errors are going to happen. But processes that are implemented can avoid those errors from becoming fatal. Next slide, please. So what can we do? We have this goal of zero by 2030. And I, again, thank World Health Organization for making this bold goal, because there is no other goal. Who's going to be harmed? Our family members? No, it's got to be zero. But how we got to get there? We got to make the decision to lead us to zero. Every individual has to say, I am the one that's going to get us there. It can't be the person on my left or the person on my right or the patient safety experts. It's got to be the people on the front line, the people leading government, the people leading medical technology companies, medical hospitals. They have to each say, we're going to do it. And we got to plan for zero, not just hope for it. We have to implement plans. And we have to join with other stakeholder groups to propel us to zero. It's not going to happen if we do it in silos. We have to unsilo the healthcare ecosystem. And I think it's critical that we make a public pledge, because when you measure something, it improves. But when you measure it publicly, it improves faster. So there's a power in putting a goal out there and letting everyone know, whether it's a hospital or a country, we're going to go to zero. And again, last but not least, we need everyone working together. Next slide, please. The stakeholder groups are obviously the advocacy. These are patient advocates, people who have lost loved ones. It could be nonprofit organizations like ours, but it's got to be also clinical science and technology. We need #1 clinicians. They're not the problem. No one goes into this hard work of being a doctor or a nurse or a pharmacist, what have you, wanting to hurt people. They do it for the opposite reason. They are in there to help people. So we need them. We need the healthcare technology companies. We need engineers. We need the professional societies. In academia, we need colleges and universities, researchers, the students. And in policy and finance, we need government stakeholders, ministers of health. We need insurance companies, lobbyists, and lawyers, and legal community to help us put and frame it all together. Next slide, please. So I'm going to pass the mic to Dr. Ratna Devi. I know Dr. Neelam, you'd like to probably say a few words about Dr. Devi's great work. But again, I just want to thank you, everyone who's on this call, but WHO and Dr. Neelam for your tireless work in making this possible. Thank you.
Thank you very much, Joe. It's truly, truly exemplary, the work the Patient Safety Movement Foundation has done, and under your leadership and your personal passion and commitment is amazing. So you inspire the young generation and all contemporary people work with you. And particularly, I think what you have demonstrated through concrete action at the hospital and facility level, how different stakeholders have been brought together and how demonstrable reduction in patient harm has been achieved. This is absolutely amazing. And particularly, you touched upon also the role of different stakeholders, professional organizations, international organizations. Each of these partners and stakeholders have a very important role to play in implementation of the Global Action Plan. It will take everyone to work together at all levels, global, regional, international, and national and local level, to bring the change we want to see. So I really appreciate, Joe, for your leadership and for taking time to join with us very early morning for you. And thanks again. And of course, we will keep in touch with how things develop. I am now very delighted. Thank you, Joe. I'm very delighted to introduce the next speaker, as Joe mentioned, Dr. Ratna Devi, who is a patient safety advocate and speaking from the patient's perspective. And we thought when we were preparing the agenda for this launch event, that it's very important to have patients' voice as well when we are speaking of stakeholders as organizations, professional bodies and different stakeholders, but patients as co-producers of health is very important. So Dr. Ratna brings the patient's voice to this particular launch event. And she is the chair of the Board of Trustees at the International Alliance of Patient Organizations. So Dr. Ratna, such a pleasure to have you with us. Please take the floor.
Thank you, Dr. Neelam, and it's a pleasure to be representing the patient voice. So as people know, IAPO is one of the largest patient representative organizations with members across the globe. And it is not only the IAPO member organization's voice that I bring to the floor, but every single patient in the world who has experienced any harm or who can, through education, be able to express when there is a harm that is going to happen. So as the topic says, it's strengthening collaboration and partnerships, and we are talking about patient safety. So there can be no safety without the patient voice in it. And the patient voice cannot be tokenistic or cannot be at just the healthcare institutional level, but at all levels of the chain, whether it is the policy or the research or everywhere. And I say this consciously because if I were given an opportunity, I would put the patient voice in all the 35 strategies. Because every single person who is attending today, or every single person across the globe, I can say with some amount of confidence, has been a patient at some point in life. And if we take away the hats of our day jobs and we think about the times when we have been to a hospital and had an unpleasant experience, all that could actually add to a huge body of evidence to show where harm is happening and how we can prevent that. And this is all coming from the patients. So patients as stakeholders are one of the most important pillars. And as I said, patient experiences can provide valuable insights into gaps in the healthcare system and help find solutions to address them. It's the patients themselves who can tell you where things have gone wrong and how that can be corrected. And when several patients are reporting same or similar harm, it can lead to a huge body of evidence against the therapy or the process, and then we can work on how we can correct those gaps. Next slide, please. So while I have, talked about this whole aspiration of being in all the 35 strategies, I've tried to pull out some of the main points where patients and patient organizations can be included as partners. While we talk about the strategic objective 4 and all its activities under it, I felt that strategies 1.3 and 1.5 can also be important areas where patient organizations can be partners, and patient-led organizations can raise public awareness and the impact that safe staffing has on patients, families, and communities. They can help and shape and amplify the messages of the World Patient Safety Day every year through networks and their own partners and alliances, and support the implementation of the annual World Patient Safety Day goals. They can also collaborate in implementing of the existing WHO Global Patient Safety challenges, and can really be active partners in this. Next slide, please. So coming to strategy 3.3, we can help as patient organizations, patient leaders, and patient advocates to raise awareness on the importance of preventing healthcare associated infections. And this is a huge problem, and it has come to light now in the context of the syndemic that we have faced, where many people have died because of infections due to antimicrobial failure. So patients and general public, common man has to be educated on this aspect as well, and patient organizations can really partner in this area. Coming to strategy 4.1, where engaging patients, families, and civil society organizations in co-development of policies, plans, strategies, programs, and guidelines to make healthcare safer is concerned. Patient organizations can be partners to conduct research to identify behaviors that constitute and support patient and family engagement. They can disseminate patient safety rights charters that are created at the institutional as well as the government level, and promote the idea of patient safety as a human right so people can report when some harm is happening. Advocate full participation of patients, families, and communities in all patient safety planning and programs at global, national, and local levels. And these can be patient safety champions who understand the legal as well as the other procedures and can be part of technical as well as other planning groups. Patient organizations should also be included to create community oversight mechanisms for local healthcare facilities and local patient assistance programs, so that patients who encounter problems in their healthcare are able to report them. And these can also be included in goals related to patient and family engagement as a key components of both short-term as well as long-term strategic plans. Next slide, please. Learning from the experience of patients and families, as I said before, can lead to a huge body of evidence. And this can be done by including patients and patient groups, patient organizations in national and local workshops, symposia, and events to share their experiences, especially in professional conferences and seminars that happen. And ensure that professional associations also include caregivers, so that patients who are not able to talk for themselves can actually share their experiences through caregivers. And most importantly, for patients to be able to share their experiences confidently, it is important that their capacities are built as patient advocates and champions. IAPO already does this through several programs, and we can widen this ambit to other patient groups who are interested to train champions. And patient organizations and their networks can be used to identify, recruit, and train patient advocates in several parts of the world, at both the national as well as the subnational level, and create champions for patient safety to serve as patient representatives in several bodies, starting from the government to the district, sub-district level, and several healthcare settings as well. Patient groups can also develop and disseminate patient information materials on different aspects of patient safety and participate in public awareness campaigns, and we can work actively with the government to support the development of national patients for patient safety programs. So IAPO has a program that actually tries to develop these kind of champions in various member organizations. Next slide, please. Coming to strategy 4.4, establishing the principle and practice of openness and transparency. Most patients do not report harm because of retribution. So raising awareness about safety reporting systems, having a policy of no blame, and giving the right kind of compensations is important for raising the trust as well as the confidence of patient groups. And raising awareness of civil society organizations, patients, and families, and seeking the full support of professional bodies and their members for a policy of open disclosure is important, and patient groups can play a very important role in this. Raising awareness of civil society organizations, patients, and families about the positive purpose of open disclosure, and this leads to the trust and the confidence that I talked about. Coming to strategy 4.5, providing information and education to patients and families for their involvement in self-care and empowering them for shared decision-making. And we see this happening more and more As people are moving to home health care, digitalized and remote monitoring systems, etc. So patient harm also needs to be captured in those settings. And therefore, it's important that patients and patient groups are empowered to do that. And we can do it by peer education for patients. So expert patients can transfer their knowledge to other patients and patient groups. And we can also include patient and family engagement and safety in educational curricula, both at professional level in medical curriculum, as well as the paramedical curriculums. And we can also disseminate information and education materials on patient safety. Next slide, please. That brings me to the end of my presentation. Thank you. And back to you, Dr. Neelam.
Thank you, Dr. Ratna, and thank you, Joe, for a combined presentation on the role of stakeholders and what actions have to be taken, and particularly mapping all the patients' engagement and empowerment across the action plan, which is very, very impressive, and will really provide a vision to all patients and communities and families and professional organizations to work together with the governmental agencies to achieve the goal of the action plan. Thank you so much indeed. So moving on to the final presentation of the launch event, we've heard from the three important partners in action: governments, healthcare facility services, as well as stakeholders. Now it's the role of WHO and what actions WHO has to take. So it's my pleasure to introduce my colleague, Dr. Mondher Letaief. Dr. Letaief is the WHO regional advisor, and he's the lead for patient safety and quality at the WHO regional office for the Eastern Mediterranean region, and will present the action for WHO. Dr. Mondher, the floor is yours. Thank you.
Thanks, Neelam. So this is a great honor for me to be with you and to share with you this presentation, which is about what role can be given to the what WHO can play, the role of the WHO in order to push forward and drive forward the global action on patient safety as a strategic priority. In this presentation, we will start with the background and the context, the global movement, the global patient safety action plan, the WHO's role in advancing the patient safety agenda, upscaling actions, and take-home message. Next, please. So as you know, patient safety aims at avoiding harm to people for whom the care is intended. It underpins the principle of first do no harm, as it was repeated today several times. It is an important priority for health systems, regardless of income status, and it is critical to achieving universal health coverage, and universal health coverage without safer care would be an empty vessel. It's also one of the most important components of healthcare delivery, since safety can be considered as an entry point to ensuring quality healthcare. Next, please. Over 1 in 10 patients continue to be harmed from safety lapses during their care, and globally, unsafe care results in well over 3 million deaths per year. And the health burden of harm is estimated at 64 million disability-adjusted life years a year, similar to that of HIV/AIDS. Recent estimates suggest that as many as 4 in 100 people die from unsafe care in low to middle income countries. It is also very important to know that the high preventability of the adverse events that occur at the hospital or at different settings. And it's also very important to know that investment in patient safety offers a good returns in terms of reducing the mortality, reducing the morbidity at the direct cost and the indirect cost. Next, please. The political commitment has been very important, played a key role towards the global patient safety movement. So as it was presented by Neelam, we have had, for example, the ministerial summits played a key role for the patient safety agenda. So far, we had 4 patient safety ministerial summits. We started with London, then the Berlin, the Tokyo, and Saudi Arabia. And due to COVID-19, the ministerial summit that was planned for Switzerland was postponed. So this political commitment has contributed to the endorsement, to the awareness of member states and the endorsement of member states for the World Health Assembly Resolution 72.6. Next, please. And the 72.6 resolution, which is about the global action on patient safety, has paved the way for the finalization of the global action on patient safety. Next, please. So as you see, the global action on patient safety has one vision, one mission, and one goal, 4 partners in action, 7 guiding principles, and 7 strategic objectives. Next, please. Now, regarding the role, the WHO's role in advancing the patient safety agenda, the role of WHO needs to be, I think, adopted based on 2 things. One is the general program of work of the WHO strategy, and also the core function of WHO. Here is the 13th general program of work. And you see that we have the mission, the strategic priorities, the strategic shifts, and the organizational shift. And here, without going to the details, I wanted to highlight 2 things. One is the importance of tailoring the support to the countries based on the maturity of their health systems. It's not a one size fits all, but it will depend on how mature the health system. In some circumstances, we will focus mainly on the service delivery. We will improve, like, for example, 1 key priority, such as infection prevention control, medication safety, surgical care. But in other settings, the system is more advanced, more mature, and then it is more policy dialogue supporting for the policy, for the development of a strategy, and so on. The second thing is to focus the support that will be given, provided by WHO, and in order to drive improvement and to drive impact at the country level. So we will go beyond the normative work of WHO to focus and to seek the impact at the country level. This is the first element. The second element, next please. The second element will be, I think, extracted from the WHO's core functions. And you know that we have 6 core functions: leadership, providing leadership on matters critical to health, and engaging in partnership where joint action is needed. And we can, as an example of leadership, galvanize commitment for patient safety, setting the priorities for patient safety, effective and consistent support and awareness raising for patient safety, the integration also of patient safety in the global agenda and the global priorities. Setting norms and standards and promoting and monitoring its implementation. As an example, developing a minimum set of standards for patient safety. Or at the regional level, for example, in the Eastern Mediterranean region, we have what we call the patient safety friendly frameworks for hospitals and for primary care, which gives you a minimum set of key criteria related to patient safety and based on the evidence. The evidence-based policy options in terms of supporting and revising and providing the needed technical guidance to countries in order to develop their national patient safety strategies and policies. The technical support in different areas related to different priorities, using the tools and how to implement the tools, shaping the research agenda in terms of identifying where gaps in terms of research and developing research in order to generate, translate, and disseminate the knowledge. The monitoring and evaluation, the monitoring of the health situation. This is very important in terms of developing the information systems and the indicators in order to assess the situation, identify the gaps, and develop the priority interventions in order to address these gaps. Next, please. So given these the scope of actions that WHO will provide, there are some enabling factors that will make things, I think, more successful. One is the prioritization of the intervention. We have seen that the global action for patient safety includes a set of numerous interventions, and these interventions need to be prioritized. And I know that our colleagues started already this prioritization exercise in order to respond first to the issues that are very important to address in terms of for the countries. Second element is the contextualization of the support. It needs to be aligned with the country priorities and capacities. So and this is something that needs to be important. The Global Patient Safety Action Plan can be further adapted to make it better contextualized and to meet the needs at the country level. The third point is related to the fact that to leave no one behind and ensuring access to safer care for vulnerable population. So this is something very important. The equity in terms of access to safer care need to focus on vulnerable populations such as the migrants, the refugees, and the IDP. The third element is the learning systems, and this is something very important. And what we mean by learning systems, any are organization or networks that study, self-study and adapt using data to generate knowledge, engage stakeholders, and implement behavior change to transform practice. So if you are in a setting where the health system, you have the capacity to collect information, to analyze the information, and to translate this information into concrete actions that would help transform the practice. The accountability is something very important. Accountability in terms of reporting, in terms of participation, in terms of risk register, all elements should be there in terms of to enhance the accountability of the provided support. The integration with health policies and priority programs is important. The patient safety needs to be further integrated into the priority programs, and I'm happy to learn that this year the topic of the World Patient Safety Day is the maternal and child and newborn care, which is a kind of integration that highlights the importance of ensuring safety by combining the maternal and newborn care in one hand and the safety science, integrating them together in order to promote safer care. Last but not least, the COVID-19 pandemic has shown that how important is safety for both patients and healthcare professionals. And these are the two sides of the same coin. This has highlighted also the importance of ensuring the essential health services. And this is the safety should be given more importance in order to ensure the continuity of essential health service, as well as the management and the response in terms of preparedness and the response to the pandemic. We know that we need to create this kind of bridge between the service delivery and the health security in terms of preparedness and the response to the pandemics. Next. So in summary, patient safety, there is a heavy burden of unsafe care, and this is avoidable and good returns on investment. Patient safety is critical to achieve universal health coverage, a foundation for health system strengthening and health system resilience. Member states have committed to invest in patient safety, and WHO's Global Patient Safety Action Plan provides the pathway to enhance member states' capacity to ensure safer care, and support to countries should be tailored according to local context and capacities and priorities. With this, I end my presentation and thank you for your attention.
Thank you, Mondher. Really appreciate you highlighting what action WHO is planning to take going forward. Next, we will have a brief question-answer session, and I will hand over to my co-moderator, Donaldson, to facilitate this session. Liam, over to you. Thank you.
Thank you very much, Neelam. We do have to finish on the top of the hour. So as ever, we've had a really packed program and we've had a great range of questions. And so we will answer most of those questions in the period after the meeting and get back to you all. but we just perhaps have time for one which Neelam and I would take between us. Ali Mehdi asked a very important question: where does the responsibility of the state of mind to zero harm begin? In other words, the first objective of the strategy: should medical curricula focus learning on patient safety culture as much as the scientific medical aspects? Maybe I could say something about that, and then Neelam could say what WHO is doing on curricula. It's a really great question because it raises a number of things. First of all, in medical schools, nursing schools, curriculum space is usually very tight, and it's difficult and takes a long time to negotiate a new topic to go into curricula. So it does require action at the institutional level, the medical school, the nursing school, and so on. But it's also, I think, about, with this state of mind point that's in the strategy, it's also not just about developing skills, but also values, so that patient safety would be a value which was instilled in the students from early in their career to look at the world differently. And that itself is a challenge, because certainly medical practice, the current paradigm of individual care is very, very strong, and the concept of system care is not strong. And so you're actually looking at a generational impact on not just skills and values, but also a paradigm shift in thinking. So a great question. And Neelam, you might just say what the WHO is doing on this, because we then need to close to meet our deadline on the top of the hour.
Absolutely. Thank you, Sir Liam. So particularly patient safety is a young discipline, young scientific discipline. And when we were students, we were not taught about patient safety. And I think in the last 20 years, patient safety has really been recognized as a distinct scientific discipline, and there's a need, there has to be a place for it to grow. The patient safety curriculum, which WHO developed in 2010, and then it was developed for medical professionals, and then we developed a multinational professional edition as well. Now we are actually revamping the entire approach to curriculum development and education and training of health professionals, multi-professionals, through an approach of interprofessional learning, which is that all those who provide care, they learn together. And I think that is the way to go forward. And we are actually going to revamp the patient safety curriculum. We have already started the process, because building the capacity of health professionals in patient safety is absolutely vital to ensure patient safety. There is, of course, an important need for upstream factors such as policy, leaders, educational, institutional leadership, to provide support for education training, as well as development of safety culture in organizations. But it's absolutely vital to really provide the instrument and the empowerment to health professionals who are at the front line, all the knowledge and the competencies and the skills they need to provide care which is safe, because providing safe care to patients actually also means safety for health workers. And we realize from the health worker safety initiative that both patient safety and health worker safety are very much related, and building competencies as well as education training opportunities for health professionals will go a long way in strengthening the systems and reaching the objective of zero harm, because zero harm is not only for patients, we want zero harm in healthcare. So I think it's extremely important that we focus on the policy and the vision of zero harm. But when it comes to implementation of the vision, we have to have health professionals, their competencies and their skills to be developed, providing them the instruments which will strengthen their performance at the front line. And then also interacting with patients is something which health professionals have to do. So I would say this is a priority for WHO Patient Safety Flagship, to work towards developing a sufficient workforce which is competent in patient safety strategies and action. Over to you, Sareen.
Okay, Neelam, thank you. And thank you for all the questions. We will reply separately to those. A couple of announcements before closing. First of all, some of you are involved in a next set of discussions at 15 minutes past the hour, after this hour, and you will also be involved tomorrow. So there's a separate link from that. I think everybody knows that. Please log on to the separate link. You might want to log on a little bit early. It's open from 1500 Central European time. Starts at 15:15, but you might want to, just for technical reasons, get on a little bit early. It's my great pleasure to thank all the speakers this morning. That's been a really, really stunning launch day. We're all very excited about the future, but your input today has allowed this launch. You see the curtains being drawn there to be formally and publicly made. It's great to have over 800 people on the call. We're thrilled with the attendance today, the participation, the lovely comments that have been made in the chat box. So thank you very much. And 10 years ahead of fighting to get close to that elimination of avoidable harm in healthcare. So thank you, and thank you for pledging to join us on the journey.
Thank you, Sir Liam, and thank you to all the speakers and interpreters. We're ready to close the session now. Thank you.
Thank you.